Hello class and welcome to the final installment of this online video training series, Diabetes Management Course 401, Ask the Experts. In our courses thus far, we've learned all about diabetes from prevention to nutrition. In Course 401, we ask the experts who work in the field of diabetes management on a daily basis questions about prevention and complications due to diabetes.
Hi, my name is Dr. Michael Maldonado. I'm one of the faculty members in the Department of Ophthalmology at Texas Tech Medical School here in El Paso, Texas.
Hello, my name is Ana Siqueiros. I'm a registered nurse with the El Paso Diabetes Association, and I'm one of their nurse educators.
Hi, I'm Dr. Efrain de la Rosa. I'm a podiatrist for the Food Institute here in El Paso, Texas.
Why is El Paso and other areas of the region so prevalent to contracting diabetes?
I think diabetes is prevalent here in El Paso, primarily due to culture, our Hispanic culture, and our diet. The Hispanic diet is very high in carbs. Also, our children at the schools, they don't exercise as much as in years past.
Diabetes is very prevalent in the El Paso area because there's a lot of reasons for diabetes, type 1 and type 2. Particularly dealing with type 2, you see a lot of patients with the disease that don't understand it, and also when they do have it, they don't understand how to control it. The reason for the prevalence, I think, is just lack of education, because a lot of people just feel so good when they have the disease that they don't really feel the need to do anything about it. A lot of times you will hear about patients advancing with the disease even though they feel good, but the main reason why it's so prevalent here in El Paso is just what I would say is lack of education, and also just the food that we eat here. It is very good, however it is unhealthy, and I think that's something that will add to diabetes.
What are the basic complications of diabetes?
Some of the general complications of diabetes include heart disease, high cholesterol, and high blood pressure. Also, they can get complications with the feet and eye disease. And in both female and male, there's some complications in the reproductive organs.
Once diagnosed with diabetes, what are the best methods to manage the disease?
Management of diabetes is obviously very important. Diabetes can be very well controlled, and you can lead a normal and healthy life as long as you keep it under control. That includes proper education, proper monitoring of your glucose levels, and proper, taking your medication properly the way you're supposed to. If you can manage your diabetes, you can lead a good and healthy lifestyle, and more importantly, your family will also enjoy you as well. So,
one of the things I want to say is that even though there is no cure for diabetes, diabetes is very manageable and very controlled. It takes discipline, and discipline is hard, but it can be done.
Once diagnosed with diabetes, two of the body's extremities that suffer are your eyes and/or your feet. So exactly what is it that happens to your eyes and feet when dealing with diabetes?
One of the complications of diabetes is obviously eye disease. In general terms, we call it diabetic eye disease. In our practitioner terms, we call it diabetic retinopathy. Diabetic retinopathy is known as bleeding in the back of the retina. The retina is a light-sensing part of the eye, which allows us to see. Whenever a patient has diabetes for a long time and isn't controlled, the back part of the retina, which I like to call the film of the camera, becomes damaged. If the film of the camera becomes damaged, that affects what we see. And I always give the example of patients saying that you could have a $1,000 camera with a cheap film, and if the film doesn't work, it doesn't matter how good the camera is. Same thing with the eye. If you have a perfect eye with a bad retina, you will not see that well. So when these complications from diabetic retinopathy occur, some patients will start having blurry vision. Some people will start having flashes, little floaters in their eyes, black spots. The worst part about all this is that these are only complications that you see when the disease is advanced. Whenever it's in the beginning stages, there really are no complications. However, if we do see this in some patients, you have to have a dilated eye exam once a year to see if any of these changes are occurring in your eyes, because like I mentioned, there's nothing that you feel or see initially. Once you have your dilated eye exams and we start noticing that you have diabetic eye disease, we will properly manage you by either having you follow up more frequently or adding on a treatment for your eyes, which could include laser type treatment. There's other types of injection therapies, and in some cases surgery. So the goal obviously is to control the diabetes. The diabetes is controlled, it will not lead to diabetic eye disease. Diabetic eye disease will lead to blindness. Just because somebody has diabetes does not mean that they will go blind. It means they have a risk of going blind.
Diabetes does affect the feet. That's one of the complications of diabetes. It affects the feet several ways. It does affect the circulation, and of course, without circulation, that leads to amputations, which is what we're trying to prevent. It does affect the nerves as well, and when it affects the nerves, you lose your sensation. Your sensation is a warning system to your feet. It tells you it tells your body there's something wrong. For example, if there's a needle in your foot, you'll jump. But if you have diabetes and it affects the nerves, you may not be able to feel it in your feet. It also affects the skin in your body. It causes dryness. So anytime it affects the circulation or the nerves, that in combination is a bad thing because it can lead to amputations. And so the main complication of diabetes with the feet is amputations. And prevention is the big key here. It is much easier to prevent things than to treat the complications associated with diabetes.
And finally, once diagnosed with diabetes or at the risk of developing diabetes, how can local diabetes organizations such as the El Paso Diabetes Association help?
Well, I feel the El Paso Diabetes Association is very important here in the El Paso community. We provide a service that is invaluable. We go out to the people and we help them. We help educate them. We help them be informed, and most of all, we help them be empowered to help control their diabetes.
Well, that does it for this portion of our video training series. I'd like to thank both doctors for their participation in this course segment, along with the staff here at the El Paso Diabetes Association for their participation. Over the past 4 diabetes management video training courses, we've revealed what diabetes is, its complications, and how to prevent it. We've learned the proper diet and given you a start on how to prepare diabetic-friendly meals. We've learned about home exercise programs and given you expert testimony of the effects of diabetes from professionals who work in the field every day. But when it's all said and done, it comes down to you. While diabetes can be a debilitating, even fatal disease, it's manageable and preventable. You can live a full and quality life with the disease and turn around the chances of getting it just by following some of the basic steps provided in this series. You've already taken the first step to a healthy lifestyle by choosing this video training series. On behalf of Real House VOD, the El Paso Diabetes Association, and our community of diabetes medical professionals, I'm Tracy Presley. Goodbye and good luck.